Welcome to the deep dive. Today we're jumping right into something really important for your health, the ferritin blood test. It sounds simple, but it tells you so much more than just if you're low on iron. We're digging into this using a great guide from Blood Test UK. They really highlight how tricky iron balance can be. You need it, obviously, but too much, that's a problem.
Exactly. And ferritin, well, think of it like this. It's a protein, and its main job is storing iron, like a little locker inside your cells. But here's where it gets interesting, and this connects to the bigger health picture. Ferritin is also what doctors sometimes call an acute phase reactant.
Okay, what does that mean in simple terms?
It means if your body has inflammation going on, or maybe an infection, your ferritin levels can shoot way up, even if your actual iron storage isn't that high.
Wow, okay, so high ferritin doesn't automatically equal iron overload then. It could be pointing to something else entirely.
Precisely. Now, low ferritin? That's usually pretty straightforward. It strongly signals you don't have enough iron stored, iron deficiency. The kind that makes you feel just wiped out, weak. The test flags this quickly so your doctor can say, right, you need iron supplements or suggest changes to your diet.
Okay, so low is clear. But the high reading, that needs more investigation.
Yes, because high ferritin could mean genuine iron overload, a condition called haemochromatosis, which can seriously damage organs over time if it's not caught. Or, as the Blood Test UK guide points out, it might be a sign of inflammation from something else, like maybe liver problems or even underlying heart issues.
That really changes things. It's not just about anemia, it's like a potential early warning sign for other diseases. We've actually seen this play out. Think about these examples from Nottingham we looked at. Someone constantly tired, finally gets answers, needs iron.
Right.
And then maybe an older person showing confusion. Turns out they had dangerously high iron stores the test picked up. Big difference in care needed.
It really makes a difference. So, okay, the stakes are high, you want that balance. What's the actual test like for you? Is it a hassle? Not at all, actually. It's very quick. Just a standard blood draw, usually from your arm.
Yeah.
The whole thing. Less than 10 minutes, probably.
And do you need to fast? Stop eating beforehand?
Generally, no. That's a common question, but for a ferritin test on its own, fasting usually isn't required. Always best to check with whoever orders the test, but typically you're good to go.
Good to know. And for listeners, say, in the Nottingham area, getting the test is pretty accessible, right? Based on the source material, you've got options. You can go through your local GP using the NHS, or if you want things maybe a bit faster or need a specific appointment time, there are private clinics available too.
Yeah, having those choices makes it easier to fit this important check into, a busy life. And a huge benefit here is what you do with the results. They directly guide your next steps, especially with food. Well, if your ferritin is low, the advice is usually clear. Eat more foods rich in iron. Think red meat, lentils, spinach, beans. And maybe pair them with vitamin C, like oranges or peppers, because that actually helps your body absorb the iron better.
Okay, makes sense. And on the flip side, if the test shows your levels are too high,
then it's the opposite signal, potentially. You might need to consciously limit how much iron you're taking in, alongside figuring out why it's high with your doctor, of course.
So it's not just a one-off test either, it's useful for tracking things.
Absolutely essential for tracking. Say you start taking iron supplements because your levels were low. How do you know if it's working? Or if the dose is right?
You test ferritin again.
Exactly. Regular ferritin checks let your doctor see how your body is responding. They can adjust the treatment plan, maybe change the dose, or how often you take it. It makes the whole process much more precise.
So it fine-tunes the treatment.
Yeah, and it gives you this really valuable window into your overall health beyond just iron. Remember the information link?
Right, the acute phase reactant thing.
Because high ferritin can flag that underlying inflammation. Keeping an eye on it helps assess your risk for other major health issues too. Things not directly related to iron, like heart disease or maybe type 2 diabetes. It's a key piece of the puzzle.
Okay, so let's boil this down. The ferritin blood test, it seems like a quick, simple procedure, but the information it gives you is pretty powerful. It helps manage your energy levels by checking iron stores, protects your organs by warning about potential overload, and acts as this kind of early warning system for inflammation.
That sums it up really well. It's about monitoring that delicate iron balance. Which leads to a thought, doesn't it? If getting your iron levels right can mean more energy, maybe clearer thinking. And this simple test gives you such vital clues. What's one small step you could maybe take today? Could be booking that quick test, or even just looking up some food pairings to help your iron intake. Something to think about.
Definitely food for thought. And remember, the insights we discussed today came from the excellent resources provided by Blood Test UK. We encourage you to check out their original material if you want to learn more.